Let's talk about something that's, well, it's really tough. Trying to get support for chronic pain at work. You're juggling your health, your privacy, and just, trying to do your job. In this explainer, we're going to turn that super difficult conversation into a simple, step-by-step process. We'll break down exactly what to say and how to say it so you can get the help you need without all the stress.
If you live with chronic pain, this quote probably hits you right in the gut. One minute you look totally fine to everyone around you, and the next the pain is just so big, so overwhelming, that there's no way to hide it. It's that invisibility that makes asking for help feel so complicated. But today, we're going to make that invisible struggle actionable.
Okay, so let's dive right in. I think a lot of us have been here. When you're in a lot of pain, your first instinct is to send this long, heartfelt email explaining everything. And look, it might get you some sympathy, but it probably won't get you any action. And why is that? It's because HR departments run on process. Your request needs to be something they can log, track, and act on, not just feel bad about.
So how do you get your request into that official channel? Well, it often comes down to one single kind of magical sentence. And I don't mean magic in a dramatic way. I mean, it's about being so clear, so administratively obvious that they have to act. This one phrase can completely change the game, turning a personal struggle into a formal, trackable case.
And there it is. The real power here comes from those three letters, ADA. The second you mention the ADA, you're officially triggering what's called the interactive process. It's like a secret password. It lifts your request out of that informal sympathy pile and puts it directly into a documented workflow that has rules, steps, and even deadlines.
Right, so you've said the magic words. You've kicked off the process. But now comes the next big question, maybe the scariest one. How much do you actually share? You need to explain the problem, for sure, but you don't need to hand over your entire medical history. The goal here is to give them just enough information to solve the problem without compromising your own privacy.
This is maybe the most important mindset shift in this whole explainer. HR can't do anything about your pain, but they can do something about a functional limit. So instead of saying, my back is killing me, which is a pain story, you say, sitting for more than 30 minutes reduces my focus. See the difference? That's a specific, professional, work-related problem they can actually help solve, and you didn't have to mention a diagnosis at all.
All right, so let's actually build this request letter. I want you to think of this email like it's a boarding pass. It needs to be super clear, easy to scan, and have all the right information in the right places so it gets to its destination without any delays. And to do that, we're going to use a really simple 6-block blueprint.
Here they are, the 6 blocks. See how logical this is? You start with the formal ask, using that ADA language. Then you explain the impact on your job, using those functional limits we just talked about. Then, and this part is huge, you propose solutions with alternatives. That shows you're flexible. You suggest a trial run, you offer to get a doctor's note, and you end by clearly asking for the next step. It's a complete, professional package.
Now, you might be thinking, okay, but what am I even asked for? Totally fair question. Here's a quick list of some really common, really reasonable things that companies approve all the time. For a desk job, it could be an ergonomic chair or the freedom to stand up and sit down. For a more physical job, maybe it's a limit on how much you can lift by yourself. These are just concrete ideas to get you started.
Okay, but what about your manager? You probably don't need to send them the whole formal letter, right? This little script right here is perfect for them. It tells them what's happening and frames it around your work and performance. It makes them a partner in the solution without getting into all your medical details. It's clean, simple, and effective.
So you did it. You built the request, you took a deep breath, and you hit send. And now, you wait. And honestly, that waiting period can be super nerve-wracking. So let's pull back the curtain and demystify what's actually happening on the other side. This is that interactive process we mentioned, and just knowing the steps can make all the difference.
This is a pretty typical workflow. Your email gets logged and a case is opened. They might come back to you with a few questions or ask for that doctor's note. Then you'll probably have a meeting to talk about options. The biggest takeaway here, it's a process. If you don't hear back for a few days, it doesn't mean you're being ignored. It just means the gears are turning.
So if HR does ask for that doctor's note, what needs to be in it? Well, these are the 4 key things. And notice what's not on this list: your specific diagnosis or your MRI results. The note just needs to confirm you have a condition that affects work, state your functional limits, recommend solutions, and say how long you'll need them. That's it. Of course, let's be real, sometimes things don't go smoothly. Your request might stall out, or you might even get a no, and that can feel absolutely defeating.
But it's not always the end of the story. So let's talk about a calm, clear way to handle those bumps in the road. A lot of the time, when a request gets stuck, it's because of one of these common mistakes. We already hammered home the function, not pain idea, but the second one is also huge, asking for only one rigid solution. When you offer alternatives, you're showing you're a partner in finding a solution, not just someone making a demand. It's all about using process language, not asking for a personal favor. So what if you've done everything right? You've used the right language, you've been flexible, and you still get a flat no. Or maybe even worse, you just get radio silence. This is where having a plan is so important. It helps you stay in control of the situation and keep things moving forward. Here's your ladder. It's calm, it's methodical, and it's effective. First step, and this is crucial, ask for the reason they said no in writing. Just that act can sometimes get the ball rolling again. Keep offering other solutions and document everything, every email, every conversation. If you're still stuck, you can go up the chain internally. And always remember, there are outside resources to help if the process completely breaks down.
You know, as we wrap up, I think this quote really gets to the heart of it. We get so focused on the thing, the ergonomic chair, the sit-stand desk, and those things are great, but often, the most powerful accommodation isn't an object at all. It's an agreement. It's the simple permission to stand up during a long meeting or to take a 2-minute stretch break without feeling like you're breaking the rules. That predictable support is often what matters most.
So here's the final takeaway. Please don't get paralyzed trying to write the perfect, flawless request. It doesn't need to be work of art. It just needs to be clear, professional, and built on these simple principles. It just needs to be processable. So take that first step, use this blueprint, and start the conversation. You can do this.